muted.
Good afternoon. We're glad you could join us. And welcome to Taking Steps to Address the Public Health Impact of Falls in Iowa. This is part 3, and we're focusing on EMS today. This is the third of 4-part webinar series. Parts 1 and 2 were held in April and May of 2015, and they're archived as a recording, and they're available online at iowapha.org/falls prevention. And I can repeat that later on so that you can access that at your leisure. Due to the number of attendees in this webinar, all participant lines will be muted during the presentation. To submit a question for our presenters, please use the question feature in your GoToWebinar control panel. Janine Moody of the Iowa Public Health Association will monitor all submitted questions and pose them to our presenters during the question and answer section of the webinar. Today's webinar will be recorded and posted along with the presenter slides. A few technical tips for optimizing our webinar experience. Utilize a USB headset. Use a wired connection rather than wireless if possible. And close all applications on your computer which require a large bandwidth. Okay. Well, I'm Carlene Russell at the Iowa Department on Aging, and here I manage the nutrition program, which is the congregate home delivered meal program, but I also manage health promotion programs, and it's through this part of my job where we were able to obtain a fall prevention grant, and the webinar today is one of the grant activities. So we're really glad you could join us today. Next slide. The name of the grant is Building Iowa's Evidence-Based Fall Prevention Network. The grant was funded by the Administration on Aging and the Administration on Community Living. It is administered by the Iowa Department on Aging, and there are several goals that we're working on. One of them is to provide evidence-based fall prevention programs. And these type of programs have been proven to have good results in reducing falls. So we've been training leaders on these programs and getting those classes up and running. Another goal is to increase the awareness of falls and fall prevention here in Iowa, and increase participation in the fall prevention program as a way to reduce falls. Next slide. The objectives for today are to discuss the prevalence of falls and review the impact of falls on EMS, and recognize the role that you have in providing fall prevention, interventions, and education. And then to identify fall prevention tools and resources that you can use. And we'll be spending some time talking about 3 evidence-based programs: the Matter Balance, Stepping On, and the Tai Chi program. Next slide. So why is fall prevention an important topic for us today? It really is that falls are a leading cause of injury-related hospitalizations and emergency room visits, and this is not new to you. Also, older adults die, they're more likely to die from their fall than other age groups, and 1 out of every 27 older Iowans is hospitalized for fall-related injury. Now let's meet this afternoon's presenters. Our first presenter is Linda Fredrickson. She is the president of the Iowa Emergency Medical Services Association and the executive director of Medic EMS, an ambulance service located in Davenport, Iowa. A registered nurse and paramedic, Linda's career has focused on the areas of critical care, emergency services, and public safety, which has sharpened her drive for effective fall prevention programs in the state of Iowa. Then she will be followed by Jim Fox. He's been with the Des Moines Fire Department since October of 1990 and has served as an assistant EMS coordinator since April of 1999. Jim has been a paramedic and EMS instructor for 20 years. Jim will be followed by Barb McClintock. She's worked in the Aging Network for over 31 years. Since retirement, she has continued to be involved in serving as chair of the Iowa Fall Prevention Coalition. She's a master trainer for both Better Choices, Better Health, Chronic Disease Self-Management Program, and the Stepping On Fall Prevention Program. She also serves as a coach for the Matter of Balance Fall Prevention Program. So with that, I would like to turn the program over to Linda. We're getting her switched around so she can manage her own slides.
Okay, just checking to see if you can see my screen now.
Not yet. We're seeing a picture of Barb.
Let's see here.
Well, if you'd like, Ginny, you can do this here. Oh, you've got it now.
Got it?
Okay, we're ready. Thank you.
Okay, great. Okay, well, thank you very much for inviting me to speak today. We're going to go ahead and talk a little bit about how fall injuries impact the emergency medical services system. What we've noticed as a huge problem is a steady increase in fall-related injuries, not only in Iowa, but in our entire nation. And we do expect this will increase even more with our aging population. In our country, adults 65 and older, falls tend to be the leading cause of non-fatal injury and death. National findings from the Agency for Healthcare Research and Quality show that many people, actually 2 million who are 65 and older, were seen at a hospital for a fall-related injury. Almost a third of these resulted in a hospital admission at a cost of $7 billion. As our population ages, our trend suggests that the high cost of burden will likely increase at a marked pace. And estimates in Iowa predict that the population in our state for those over 65 years of age will increase by 52% by 2030, which will predictably strain not only our patients, but our healthcare systems and society overall. When we reviewed some data from the Iowa Fall Injury Report, which is a retrospective study using information supplied by the Iowa Trauma Registry, trends were looked at over a 10-year period from 2002 to 2012. And they showed that about 56,000 patients were admitted to an Iowa trauma care facility due to a fall-related injury. About 2.6% of those patients died, and as we look to see the types of medications and things that patients are on, today we're seeing a lot of clot inhibitors and platelet inhibitors, and what happens is when these patients fall, if they have head injuries or any other critical body area injuries, they tend to have death related to bleeding problems. The interesting thing is that we've done a great job in our state and in our country of doing some prevention efforts for other types of trauma, and we typically think of motor vehicle trauma. We think of car seat safety for kids. So the rate for the other trauma has actually decreased, and now we're finding that there has been a huge gap between the fall rates and the trauma, and we have to wonder why. When we talk about types of falls, we wonder what type of fall is most common in the older adult population. And typically, these individuals aren't up on roofs and ladders and things like that, so they tend to be same-level falls caused from slipping or tripping. So to prevent falls, we really want to know exactly why they occur. And the sad part about this is that most fatal falls will occur at home. How do falls impact our EMS system? Well, we know that they're very much weather related, but they are a predictable part of our everyday call volume. A significant portion of the EMS dispatches and transports are related to falls. These do tend to involve patients who are frequent flyers, so they tend to be losing some of their mobility attributes, and they tend to be falling, getting up out of bed, getting up out of the chair, when bathing, possibly in the shower, and things like that. You have to wonder why our rates of other injuries have decreased while our falls have increased, and I think of it as maybe a bit of a knowledge deficit in our EMS community about the types of partnerships and resources that do exist for aging individuals in our community. So we have kind of an ineffective coordination of all of our stakeholders. If we could really start looking at prevention instead of just accepting that falls are a normal part of aging and they're going to happen, a reduction in the fall rates could really reduce patient injury, death, and disability, which would be great, as well as reduce the strain on emergency medical services, which tend to become busier every day. So what do we do as EMS providers in our state? Well, we care for members of the community every day on either emergency or non-emergency types of calls. Falls can be prevented by taking a prospective, collaborative community approach, and we as EMS providers can work within the community to decrease the incidence of falls in a couple of ways. Who are the EMS providers in our state? Well, we actually have about 12,000 individuals who are certified as EMS providers in the state, and as we know, the state of Iowa has a high percentage of volunteers. The types of EMS providers include emergency medical responders, or EMRs, emergency medical technicians, or EMTs, advanced emergency medical technicians, or AEMTs, paramedics, and critical care paramedics. And these individuals come from a variety of service delivery models, including volunteer operations, which are the most prevalent in our state, fire departments, those who are based out of hospitals, and private providers who might be in a not-for-profit or a for-profit setting. When we think back to the 60s when EMS systems were originally developed, they were developed to care for patients with serious emergencies. But as many emergency departments have evolved, we have also very similarly become a part of the solution for the underserved in our nation's healthcare services. How does our EMS system work? Well, somebody picks the phone up and dials 911, or they may also call a non-emergency line to place a call for service. That call for service might be for an emergency, or it might be for a non-emergency. True emergencies exist only in about 5 to 10% of all 911 EMS calls. But the fragmentation and inefficiencies of our services in the country are really impacting the chronically ill, the elderly, and the mobility impaired. Multiple providers offer only niche care, commonly during normal business hours, which doesn't always meet the needs of the patients. And many times, after hours, patients are referred to the emergency department, even though it's not the most appropriate place for them to receive care. Emergency medical services is kind of a fallback or a stopgap, as we all know, because we come and take care of patients 24/7 as soon as they call 911. That's what we're here to do. Affordable Care has questioned the current way that we operate and is indicating a movement towards a new healthcare structure. So right now, EMS providers are structured around a fee-for-service model. If we transport patients, we will be paid to transport patients in most occurrences. Recent healthcare reform efforts such as the Affordable Care Act is now converting over to a value-based model that considers some specific metrics such as a customer satisfaction rating, a patient outcome, did the patient improve or did they not, and the avoidance of readmission. So what other options exist here? What we're seeing now is a shift from a fee-for-service to a value-based healthcare system, which will have dramatic effects on EMS delivery. Historically, we were compensated to provide transport. Patients expect to be transported to emergency departments, and concerns regarding potential litigation for non-transport are certainly at top of mind for all of us. This is inefficient, it's costly, and it's challenging. Some states have adopted a mobile integrated healthcare practice, also known as community paramedicine, and this is a delivery strategy for interprofessional medicine. It certainly was never intended to replace or disrupt patient care delivery models already in place, and it's intended to serve a range of patients in the out-of-hospital setting by providing patient-centered, team-based care using many resources. What we really all need to get together to do is to provide care at the right time, the right care, at the right location, and at the right cost. So successful community paramedicine or mobile integrated healthcare programs are community-based. The EMS system design really needs to address all three elements of the Institute for Healthcare Improvement's triple aim, which include to improve the health of the population, to enhance the patient experience of care, including quality, access, and reliability, and to reduce or control the per capita cost of care. What are some strategies that we could use as EMS providers to reduce falls? To do this, we really need to have a great knowledge of our community resources that are available. We have to be an integral part of the Community Health Needs Assessment and Health Improvement Plan. How many EMS providers that are listening today have been a part of their Community Health Needs Assessment and Health Improvement Plan for their local county? Hopefully, almost all of us. Can we perform a fall assessment? Yes, and many services are already doing that. When can we do that? Well, obviously it could be on any encounter, but the time to conduct a good fall assessment is not on a life or death 911 call. How about during a refusal? Because many times we'll receive a 911 call for a patient with a fall. We'll come in, we'll evaluate the patient and assess them, and the patient will not be injured, and they'll say, I'm fine, I don't need to go to the hospital, and we'll go ahead and do a refusal. That would be a great time, if time permits, to conduct a thorough fall assessment. Another thing that we could be thinking about would be to have some scheduled home visits by EMS providers when time is not a critical factor. These could be routinely scheduled for patients in the post-acute transitional care phase, which would also assist in preventing hospital readmissions. So for example, if we know that there's a patient who's going home that might have some challenges just in accessing the residence or the place that they live, or there might be some concerns by family and loved ones about mobility in the home, if there is a way that those community resources could be tapped to include EMS providers to come in and provide some sort of counseling or assessment, that would be great. So education right now is key, certainly for EMS providers, on how to conduct a proper and thorough fall assessment, and to also utilize tools that are available to provide education to patients on how to reduce fall risk and to initiate referrals to recognized local or state fall prevention programs. It's also really important to work with patients and their families on how to reduce fall risk. How do we know if our fall prevention program works? Anything that we do can be measured, so think of the key performance indicators that should be used to measure the effectiveness of EMS fall prevention efforts. A few things to look at is go ahead and do some benchmarks. Do some pre-fall prevention program measurement of fall rates, number of fall-related ambulance dispatches and transport, number of fall-related hospital readmissions, and customer satisfaction. Certainly you could do a survey from any visits that you do to do a fall assessment, and then some fall prevention program encounter rates, and then do a post-fall prevention program measurement to do a comparison. Hopefully we're going to see that the program is effective and that falls have decreased. And that concludes my slides.
Hi, this is Jim Fox. I'm the EMS Assistant Coordinator for Des Moines Fire. And I'm just going to kind of go over what Des Moines Fire has been looking at and what we've been doing here. The first slide here, we're just going to kind of talk a little bit about the demographics we have in Des Moines, our 2015 statistics we've had, some education we've been doing, how we look at it as life safety, and the Department of Human Services if they have to get involved. Next slide. All right. The last year that we have for population-wise in 2013 was a little over 200,000 people here. They divided it down to just a little over 50% male and just under 50% female, with 11% being greater than 65 years of age. We cover the 82.6 miles. We do that with 10 stations. We have 8 paramedic ambulances on the street 24/7. We augment that with 4 paramedic engine companies that can respond in front of our or with our paramedic ambulances. And the remainder of them, the 9 BLS engines providing basic life support, or the truck companies. Next slide. We did a lot of demographic studies in the city of Livingston, Des Moines, to figure out where most of our calls were coming from. And you can see that in last year, and this hasn't changed from about 2 years now, we have 24 addresses that account for 40% of our call volume in Des Moines. In 2015, you can see that our call volume there, just for the whole department, was just under 23,000 calls, and 15,845 EMS calls, and that's everything. That's the public assist, that's the ones we transported. We wind up, last year I think we transported about almost 3/4 of those people. So with that, looking at just our public assist calls that we go out on with our engine and truck companies, a little over 1,600 calls last year were for either an assisted invalid that couldn't get up, public assist, with fire apparatus. These are all basically the same thing. A lot of them are people that can't get up off the floor, they tripped, or they can't get up out of their chair. We've had calls where family members have called us to get their loved ones out of bed and into a chair because they have no means of moving them. So this is kind of the whole thing with that 1,600 calls we had there. With that, we went down and pared it down to a total of only 70 accidental falls, but 44 were equal to or greater than 60 years of age, 18 male, 26 female, and a high percentage of those were resulting in fractures from those falls. Unfortunately, I don't know the final outcome of the fracture, how the patient fared in the long run. So in the meantime, starting in January of this year, we've been partnering with the Iowa Falls Prevention Coalition for about a year now. We've been handing out pamphlets and the brochures and the flyers, and starting in January, we started tracking that number. When our crews go in, they start looking at the scene to see what they tripped on. A lot of times it's the throw rug, the drop cord, a loose rug, and our crews are recommending that they remove those so they don't trip over them. We're going to do something with them. They're also handing out the falls prevention brochures on trying to get them, help that way. We're also tracking the addresses. I went back every time our crew hands went out, they let us know in the EMS section, and we tracked that address, how many calls we had prior to that fall, they're handing them out, and then afterwards. Right now, most of our calls, we haven't seen a big increase in our falls. We've had a few that we had quite a few last year, but we haven't seen them a lot this year. But we're only just about 2 months into the year, so we'll find out what happens after that. This is the brochure, one of them that we're handing out. There's about 3 things there. But we actually talk to the family, we talk to the patient, give them information on how they can get help. They kind of go through the check risk for falling over there, see if they meet any of that. And then we make recommendations that they call the Lifelong Links number on the back of it to try and get them some help. We also, if they do have home health aides, home health agency in there, we'll also call them and let them know what's going on with the patient to see if they know how many times they've fallen. There was one address that we went to last year. Between October 1st and the end of the year, we were there 41 times. And tracking the same address this year, we've been there 16 times already this year. So we've been calling the home health agency trying to get them some help. We're looking at this as a life safety issue with it. And we're trying to prevent these falls because people are getting hurt. We're doing whatever we can to try and prevent it. Fracture is the biggest one because of the life-altering consequences, the reduced mobility. A lot of them wind up in long-term care facilities and big increase in mortality, like Linda said. This is going on. It's getting worse, unfortunately, throughout the year as the population ages. Our population in Des Moines is aging, and we're seeing more and more of this, and we're trying to figure out a way of reducing that risk. We don't want to give anybody the impression we're trying to stop going out to these calls, that we don't want to make it. The whole thing is a life safety, trying to educate the elderly so they can be safe in their home and they can stay there a very long time. Unfortunately, that doesn't happen all the time with the falls. So, when the Department of Human Services, they're being mandatory reporters. When we see people that are unsafe in their home and they cannot be safe in their home and there's no family there to help them, we keep going back to the same address a lot. Unfortunately, sometimes we have to call DHS and make that abuse report out on them and have them come in and make an assessment to it. So with that, we try and do the evaluation, try and get them help first, but there are times when we have no choice but to follow our mandatory reporter and turn them in, and we want that person to be safe. We don't want them to get hurt at home. And if you have any questions, we'll take them at the end.
Hi, this is Barb McClintock, and I'm going to be talking about the tools and resources for fall prevention and the community options. The first resource I'd like to point out is the Iowa Fall Prevention Coalition, and it's a statewide coalition with over 30 members representing health agencies, government agencies, and community interests. And we have 3 goals. The first one is kind of what we're focusing on today, and we hope that part of this webinar assists you in locating the services in the fall prevention programs in your community. We also will be sponsoring a symposium on July 8th in Ankeny at the Des Moines Area Community College campus at the Future Farmers of America Conference Center, and that's to provide current information and resources to community professionals. So you might want to put that on your calendar if that would work and save the date. So our education aspect is really what we're working on today. Next slide. There was as Carlene mentioned, there is a grant that that the Department on Aging received here in Iowa, and we wanted to expand 3 evidence-based fall prevention programs across the state of Iowa. So what we did was use that grant funding to train not only leaders for these programs, 2 of which already existed in Iowa, but also to get some master trainers so that they would be able to train leaders after the grant was over with. And so the 3 were a matter of balance. The new one was stepping on, and Tai Chi for arthritis and fall prevention was the 3rd one. Next one. This is a map to show how we're trying to spread it throughout the state of Iowa. Last week, we actually trained 16 more leaders for the Stepping On program. So we'll update this map, and it'll look a little more covered in the next few weeks. Also not represented on this map are the 63 instructors for the Tai Chi with for arthritis and fall prevention, which have been trained in this 2-year period. Most of those are located through the YMCA programs, but they do have leaders in Fairfield, Clive, Osage, Carroll, Boone, Ames, Fort Dodge, Malvern, Ankeny, Waterloo, Clive, and Independence. And so if you heard one of your areas named, you can actually call them and see when the Tai Chi and if the Tai Chi is being offered at this time. Next slide, please. So the first program that we're going to talk about is a matter of balance. And the goal of this program is to reduce the fear of falling, stop the fear of falling cycle, and increase activity levels among community-dwelling older adults. Now, over 1/2 of community-dwelling older adults experience a fear of falling, and many respond to this concern by curtailing activity, which just causes their mobility issues to become worse and worse. So large portions of falls are preventable, and matter of balance, while acknowledging the risk of falls, help participants to find ways to change their environment to reduce the risk and to increase strength. It is done in a group setting, and there are 2 lay leaders that facilitate the 8 sessions. Each session lasts 2 hours long and includes some exercise and a lot of group sharing. After completing matter of balance, 97% are more comfortable in talking about fear of falling. 97% feel more comfortable increasing activity. 99% plan to continue exercise, and 98% would recommend matter of balance. And one of the things that we discovered was that people really do fear talking about falls, which is why EMS personnel can be so important, because if you're picking someone up from a fall, you can then visit with them a little bit about that, or hopefully you can visit with them a little bit about it, so that you can make them feel a little bit more comfortable in exploring the options that they might have. Next slide. The second program is called Stepping On, and this is a 7-week, 2-hour session program, and it does have exercises that are progressive in that we provide ankle weights for people to challenge themselves to increase their strength in their lower extremities. But also, we have guest experts that are brought in to discuss vision and how it impacts falls, community safety issues, and medicines. We have physical therapists attend 3 of the sessions first to introduce the exercises and help people understand how to do them correctly. The second session they come to guide and answer questions regarding the exercises, and then show how to get up from a fall or from the floor, and then efficient use of adaptive devices. And then they come back on the 6th week and actually take people outside and help them to walk over uneven terrain, going up steps, up and down curbs, and anything that might have been designated in the first week as a concern of the class. So the physical therapist is really an important part of this program. We use adult learning principles to help build the self-confidence in making decisions in situations where they are at a risk for falling. And you can, next slide, maybe. There we go. This is a session. Generally, you want to have between 12 and 14 people in a class. And after completing the course, there was a 31% reduction in falls. If you want to do the next slide. This is session 6, where people are practicing on uneven terrain. And we, as leaders, the 2 leaders, co-facilitators, bring in adaptive devices, some safety tools that people can use at their homes, so that they can actually see what it is that can maybe make their home a little safer. The woman on the left is using hiking poles to improve her gait and her balance going up and down curbs. Next slide. The third program that we were trying to expand throughout the state of Iowa is Tai Chi for arthritis and fall prevention. Tai Chi has been shown to improve balance, reduce fear of falling, increase strength, improve functional mobility and flexibility, and increase psychological well-being and reduce the risk of falling. The type of Tai Chi that we are teaching is called the Sun style. You know, and Tai Chi is part of the Chinese martial arts programs. There's something like 20 different ways of doing it, but we use the 12 motion Sun style. And that focuses on upright postural control. As you can see in the photos, there are a lot of bent knees so that you have a lower center of gravity. And then it really focuses on shifting weight. And so when the weight shifting helps with walking. So you have the heel that strikes first, and then you move to the ball of the foot. Also included in this is relaxation, proper breathing, and confidence building. It's recommended that this program be held 2 times a week with a goal of 50 hours to see the real benefits of this program. And in a study, it found that recurring falls were reduced by 70% with people who practice Tai Chi. So there are some screenings for risk assessment, and the first one, which is for more the clinical settings, is one that is called STEADY, which stands for Stopping Elderly Accidents, Deaths, and Injuries. And so that's really in the doctor's offices, a little more in depth. But there are 3 that are really fairly easy to do and don't take a whole lot of equipment. The first one is TUG, the timed up and go, where a person has, what you need is a chair and then a measurement of about 10 feet, well 3 meters, 9.75 feet. And what happens is the person is sitting in a chair and you time how long it takes them to stand up, go that 10 feet, and come back to the chair. They're saying that that if it takes much longer than 15 seconds, that person might have some issues and might be at a risk for falls. The second one is called chair to stand, and you do this one for 30 seconds, and all you need is a chair, and you time how many times a person can stand up from a seated position in 30 seconds. And depending on their age group, if the age group is, say, a woman in the age 65 to 69, you're looking for the ability to sit and stand 15 times to show a good lower body strength that will help them maintain their physical independence. And the last one is the 4-stage balance, which I think is kind of interesting. The first one is they stand with their feet together, and if they can hold that for 10 seconds without having to take a step, you move to the second stage, which is where you have a half tandem stand. That's where the toe is put by the arch of one of the feet, and so that they're standing with their feet next to each other, but the one foot slightly to the back of the other foot. And if they can stand for that without losing their balance, the next step is a complete tandem, where you have the one foot behind the other foot, toe touching the heel, and hopefully, and you see them do that for 10 seconds. And finally, if they pass all of those, you can do the stand on one foot to see if they can balance for 10 seconds. However, if they miss the first three, any of those first three, if they do not pass that, they might be a candidate for the previous mentioned classes. I think Jim covered this really well on the brochures that are available. There are 2 of them. This is the first one side of the Stay Independent, Assess Your Fall Risk. And then this is the checklist. And the thing I like about this is when you leave this, the person can go through this and check and see. And if they answer 4 or more of these yes, they encourage them to talk to their doctor, because they could very well be at risk for falling. Next slide, please. And this is the second brochure that I think is really effective. It talks about 6 points on making yourself safer and what you can do to prevent falls. Everything from changing your environment in your home. Next slide, please. To reviewing your medicines, talking to your healthcare provider, have your vision checked, and talk to your family members. And exercise, which of course was what I was talking about, and hopefully you can make the referrals into this. Now, when you leave these, there will be information on that. And the next slide, please. And there are, you can actually download these brochures for distribution from either the Iowa Department of Public Health and that website there, or the Advisory Council of Brain Injuries and that link. And if you download them and you hand them out, it's going to put into their hands, in the people in the communities, into their hands, the next slide, the 2 referral sources here, lifelong links. And I always like to have a phone number, because a lot of people are maybe a little hesitant on getting online, but lifelong links can give you the resources of where the classes are being held and what resources are in your community for fall prevention. And of course, the Iowa Department on Aging, which can be the contact for the Iowa Falls Prevention Coalition, and also for community resources.
I want to thank our speakers today, but also I'd like to draw your attention. The attendees may access all of the presenters' slides in the handout portion of your GoToWebinar control panel. That would be in the lower right bottom of that control panel, and then you'll be able to get the handouts. In addition, all the slides and a recording of today's webinar will be posted online at www.iowapha.org. I'll repeat that. www.iowapha.org. And then when you get to that website, click on Hot Public Health Topics and then Fall Prevention. We have a few minutes to respond to attendee questions at this time. Remember to submit your questions using the question feature in our GoToWebinar control panel. So Janine, do we have any questions?
Comment that Tai Chi for arthritis and fall prevention, those seated and standing are now available in Scott County.
Okay.
Oh, that's great news.
Okay. Can everybody see your question? Okay, I need to read this. The Tai Chi arthritis
And fall prevention.
I'm not reading.
Okay. Okay, and fall prevention, both seated and standing are now available in Scott County as well. So that's really exciting because that is a program that has shown to have such a big impact on recurring falls.
I would mention if you're looking for a class in your area and you don't see that on the Iowa Department of on Aging website, there also is, along with the classes, there's a list of leaders. So you could look at a leader in your area and then call the leader to see when their next class will be. That will help you connect with those classes. We don't have any other questions right now. Maybe Jim will make a comment.
I'd like to encourage all the EMS providers out there to get your city government involved if possible. Here in Des Moines, we have approached the city, and on the city cable channel 7, it's either this week or next week, they haven't given us a firm date. They're doing about a 4-minute little public service announcement on falls for the elderly, trying to tell them where they can go to get help, how they can get help, and the classes that were mentioned today and where they can take the classes at. Also, remember that Aging Resources is one of the backers and providers of this, and we make referrals as well as you can make referrals out there to one of the resource, like Aging Resources out there, to get them help if you think they need it. You can certainly call, make a referral. You can talk to the families that you come in contact with or the patients and ask them also, would they be willing to allow you to call or have somebody call them to ask to see if they can get help.
Oh, there is a clarification on the Tai Chi for arthritis in Scott County is being offered through Milestone's Area Agency on Aging. So they wanted to make sure that that was noted. And, you know, look to your local area agencies on aging for resources because they have a wealth of information and assistance for people who are living in their homes as well as those people who are not. But it's you know, make sure that you consider your local area agency on aging a resource.
And if you're not quite sure where the area agencies are, if you use the lifelong links, they will connect you with the nearest area agency. Linda, do you have any comments that you would like to make?
I don't. I really appreciated being a part of this webinar, and I think that there are many, many resources out there for EMS providers. And I appreciate being directed towards those, certainly in Scott County, as well as the rest of the state of Iowa.
Well, I think you can see through the presentation that Linda and Jim made that falls is really a big deal, and you know that from your everyday work. So we're hoping to find or provide you with some resources that might make a difference in reducing the number of falls and helping the older people so they don't suffer all these injuries. I think we're ready for the next slide. It's good. The Fall Prevention Coalition would like to invite you to participate in our next webinar. We don't have a date of that set up yet, but we will be sending out information, so be on the lookout for that. But we do have a date for the Fall Prevention Symposium, and Barb had mentioned this earlier, but it will be July 8th in the Ankeny DMAC campus, and we'd love to have you join us for that, so save the date. And with that, we'd like to thank you for sharing our time with us and learning more about this. So at the conclusion of this webinar, we want to, you'll be receiving a brief evaluation of the session, and we would really appreciate your feedback. An audio recording and the slides will be made available as well. And Janine, do we have any last questions or comments? Okay. We'd like to thank you very much and have a great afternoon.